Scanning the room. Okay, hello, my name is Jamie Corsa. Today I'm going to demonstrate how to insert and remove an NGT tube. So first, right now I am outside my patient's room. I have just performed hand hygiene, and I have received her fluid intake and output, as well as the provider orders. So I just want to make sure, you know, her name, Shirley Cost 54, date of birth 5/14/64. Then I'm going to go down to the healthcare providers. She was admitted to MedSurg 10/14/2019 at 8 o'clock. Her diagnosis was a small bowel obstruction. I also have her diet information, labs, vital signs, activity, as well as her IV. Also, what the doctor has ordered is an ultrasound of the abdomen at bedside, an insertion of an NGT for gastric decompression, x-ray of the abdomen after the NGT insertion, and attaching that NGT to a low intermittent suction. So I'm going to knock on the patient's door and I'm going to enter. Hello Shirley, how are you today? Good, good, okay. So first I'm just going to verify your name and date of birth for me. Shirley Cost, okay. All that, good. Now I'm just going to verify it here with your wristband. Shirley Cost 54, Shirley Cost 54, 5/14/64, 5/14/64, and it looks like a codeine allergy. Okay, perfect. Okay, Shirley, so you came in today having some pain. Okay, can you scale that pain 0 to 10, 10 being the highest? A 7, oh, okay. Can you explain that pain for me? That's kind of like a dual pain? Okay, so first what I'm gonna do is I'm just gonna listen to your bowel sounds real quick. Making sure that we're pulling up, but also obtaining privacy. Okay. Okay, Shirley. So today the doctor would like me to put in an NGT tube, which is a nasogastric tube. It will go through your tube and kind of down your throat. This will relieve some of that bloating and kind of fullness that you're having. Hopefully it will help with your pain. So first, again, hand hygiene. I am then going to pull out the towel here to lay it across the patient's chest. Perfect. Now after that, I will don gloves. Right here. Okay. All right. So just a couple of things here, Shirley. I'm going to have you hold on to this kidney basin here. This is just in case you will experience some gag reflex. So this is, you know, just in case precaution. It is a little uncomfortable, but it'll only take a minute. Then I will get you an ice cup of water, a cup of ice water, and then that's for you to drink. Have my lube, my cup, my syringe, this tongue depressor, tape. Just getting out all my stuff here. Okay. There we go. Okay, Shirley, so before I get this going here, I just want to let you know, kind of go over the procedure with what I'm doing. So what I'm going to do is I'm going to insert this through your nostril, and it's going to go down your throat, and basically it's going to be uncomfortable at first. You might experience some gag reflexes, but it will feel better afterwards. Now before I do that, I do want to know which nose to do it through. So I'm just going to plug up this nose here, and I want you to blow air out. Good. Now on the other side. Good. Now which nostril felt like it had the best airway? The left one. Okay, perfect. So we'll just go through that one. And if the patient's unsure, make sure they blow their nose. So what I'm going to do is I would put 3 to 4 inches of lube on for purpose of the video, which is water soluble, but for purpose of the video, we don't want to do this on the dummies, so we did spray lube before we came in. So then I just want to, you can do this before or after, but I'm going to do it before. I want to put 10 milliliters of air in here and hook it to the bottom of the tube. This is for when I insert the tube. Any type of leakage or anything that wants to come up can go directly into the tube. It won't do any squirting or any pressure against there. Okay. All right, Shirley, so what I'm gonna do is I'm gonna have you hyperextend your neck back. Perfect. Here, probably easier if we get your pillow out of here. There we go. Okay, so I'm gonna have you hyperextend your neck and I'm gonna start inserting. Good. Now when you get down to where the patient starts gagging, you wanna come back 1/8 of an inch here. Okay, Shirley, now I want you to go ahead and forward flex your head as well as taking your ice water, and when I say swallow, taking a drink of it. This will help with it being uncomfortable and the gag reflex, okay? So are you ready? 1, 2, 3, swallow, 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 swallow. Perfect. There we go. So now that it's far down in there, what I want to do here is I want to mark it, as well as I did forget, but you would mark it in the beginning when you measured your NG tube from the tip of the nose to the ear and to the ear down to about the mid-chest. So I would do that right there. I would then, for purpose of the video, I'm just going to use tape here, but you would get one of those bandages that would attach to the nose, which we were limited on for the videos. So you just want to go ahead and do that. There we go. Make sure it is there. And it is secured. Okay. Second, I want to take this, and I just want to take my pen light here, and I want to look in her mouth and just make sure that it looks good, everything, it's going down. X-ray will come in and double check for me, but just want to make sure everything looks good. Now I'm just going to pin it to your clothes. Want to use tape around it, but you don't want to tape it too tight to where it can ruin the tubing. Then you would just tape it to her gown, or safety pin it to her gown. Okay, good. Then what I'm going to do is whatever is in here, if there's enough, I can just pull it, or if there's not, you know, you need a little more, you can pull down. So I'll do that. And I'll put this into my medicine cup. And this is where I would dip in my pH stick if I don't drop it. Oh, I can't pick it up. Oh my goodness. There we go. I wouldn't drop it, but I just did. Okay, so then you would dip it in, and then you would check to make sure it's acidic and ranging from 1 to 4. Okay. After that, I would then hook up the tube to the suction and have it on intermediate suction. After that, I would let the patient know that I am going to call for x-ray, and they are going to come up and they are going to take an x-ray of her chest and just make sure everything's inserted properly. So I would then document the color of drainage and all that stuff, as well as take off my gloves and perform hand hygiene before walking out. Now I'm going to demonstrate how to remove the NG tube. So first thing I want to do is I will turn off the suction, and making sure that it is unhooked from here. And before I do that, I will lay this towel back down for purposes of the video. I just left it. I would then let Shirley know. Shirley, how are you feeling? Good, okay. So I'm just gonna listen to your bowel sounds real quick before we move this, making sure everything sounds okay. Okay. All right. So feeling a little better, huh? Okay. So now we will take the safety pin off. As well as I would take an alcohol swab. Usually it's an adhesive swab for the bandage on the nose to help get it off. So we'll just help do that. Kind of help get that off there. There we go. Good, okay. Now what I want to do before I pull out is I want 10 milliliters of air, or sometimes they do saline, but for this video we are doing air to clear out anything that could be in the tube. Good. Okay, Shirley, so we are going to take it out of ya, okay? And what I'm gonna have you do is I'm gonna have you just take a deep breath and hold your breath, okay? And we're just gonna rip it off like a Band-Aid, all right? So ready? 1, 2, 3, deep breath. And then making sure you're rolling it up and discarding it in a pad where the patient can't see. Okay, after that, you would take a washcloth or a towel. I'm just gonna do an alcohol swab and clean off their nose, as well as ask them if they want a washcloth to wipe their face. After that, I would ask the patient if she needed help with any mouthwash, brushing your teeth, getting that taste out, and as well as asking her if she wanted water. But before I leave the room, Shirley, I do want to just listen to your bowel sounds one more time before I leave you here for now. Good, okay. All right, so we got your mouth all cleaned up. You got a glass of water. Do you need to use the restroom or any help with that? No? Okay, just kind of want to sit here and relax from that little trauma you had there. And then I make sure she had her call light on. And then I would leave the patient's room, taking off my gloves, performing hand hygiene, as well as documenting everything. And you want to document kind of what was in the suction cup, like the drainage, color, how much it was. After that, I think we are all done. Thank you.